Hello, and welcome to the preview of the Health Literacy Training Workshop for Brownville Memorial Hospital. The purposes of this workshop is to address two key concerns for patient health literacy: communicating clearly with patients and addressing language and cultural differences. Using plain language and speaking slowly, asking patients if they understand, having patients teach the information back to you as they understand it, and encouraging patients to ask questions, all are part of communicating clearly. Addressing language and cultural differences includes identifying these factors early, as this is key in being prepared to help your patient successfully. Be knowledgeable of language and diversity services so that you can access them in an expedient manner to help your patient. And know how to access these services via computer and phone support. Have sensitivity to other cultures and their practices. These key concerns are important to health literacy. Clear communication ensures patients understand health information. It enables patients to make informed health decisions. It helps to prevent accidents and improves patient health outcomes. Language and cultural differences include the use of native language, which improves comprehension. Miscommunications can arise with variances between languages, and language interpreters help patients achieve better outcomes. The key areas of concern that we are addressing in this workshop, we need to know, is the information appropriate for the average U.S. adult? Most U.S. adults will read at a grade level significantly lower than the last grade that they completed in school. We need to know, is the information suitable for 8th grade level or below? Does it utilize plain language? Does it avoid confusing jargon or vernacular? And have linguistic and cultural barriers been addressed? Does it avoid cultural bias, which will be information that would be more difficult for certain cultures to understand due to limited exposure? Also, attempts to use common words which are easily recognized in translation to other languages is key. And remain sensitive to the values of other cultures. Health literacy is based on ability to understand based on education, ability to understand based on language, ability to understand based on customs, and ability to understand based on age, as well as ability to understand based on physical and mental limitations. A good working definition of health literacy is one's ability to understand their personal health information and to make informed decisions. Now we'll take a look at evidence to support the importance of clear communication principles and observing language and cultural access. Millions in the U.S. have difficulty understanding health information. The ability to understand health information affects health. Improved patient understanding improves health outcomes. 1/3 of U.S. population doesn't speak English. Some languages don't have English equivalents for certain words and concepts. Unfortunately, shame makes patients unlikely to ask questions due to understanding and not wanting to be exposed for having poor health literacy. Different cultural practices may also hinder treatment plans. National health literacy campaigns and policies have seen more action and revision over the last decade than ever before, as it becomes more evident that the people and government have a vested interest in finding more ways to improve public health and address health disparities. As evidence, the Affordable Care Act of 2010 was the first policy to include issues of health literacy, such as non-discriminatory practices. And health literacy is recognized here as a barrier to good health, really for the first time. And language and cultural barriers are also addressed in the Affordable Care Act. The Plain Writing Act of 2010 requires all government agencies to use simple language. And this includes any organizations that accept federal funding, which does include many healthcare organizations. And the Centers for Disease Control enacted a health literacy action plan with the intent to promote health literacy, and planning, funding, policy development, research, and evaluation of health literacy are all part of this program. Interventions at the clinic patient level and the community patient level, as well as language access services, are extremely important in patient success. Methods that have been employed are the teach-back method, where a patient is presented with small pieces of information and then asked to teach it back based on their understanding of the information or the concept. Interpreters are also other methods to intervene in situations where language or other comprehension based on cultural background is a factor. Another method would be information in a patient's language, such as printed documents and forms with instructions on follow-up with their next appointment. The best practices are understanding your target audience, making sure that you are using an appropriate language, using teach-back to make sure that your patients are clearly understanding the information that's being shared with them, making sure that the information is at an appropriate reading level, minimalizing jargon, which could be confusing, and using culturally appropriate graphics, which will help enforce more understanding of the information that's provided. As part of the training workshop, there will be a group exercise. And during the exercise, we will examine similarities and differences between human perception versus the readability software. So we will generate and compare data on readability from software tool provided and compare that with human input from the group. A health information reading sample will be scored by the software and provided to the training group after each reads and scores it using a 5-point Likert scale questionnaire provided. The data from questionnaires will be shared with the group to compare impressions that participants had on readability, and then calculate an average for the group. Software data to be compared and contrasted with the questionnaire data for results. Materials to be used in this exercise include a conference room setting, the health information reading sample, the use of the software program, the questionnaire. Pencils will be provided, and data from the questionnaire and the software tool will be used for comparison. steps to complete this exercise include to read the reading sample that is provided, assess the difficulty of words and phrases. We will not be sharing ideas during the reading phase. We'll use the questionnaires to score the difficulty level, and then choose strongly disagree, disagree, a neutral response, agree, or strongly agree. When finished, a group average score will be calculated. The group's average will then be compared and contrasted with the software data. Resources provided are included here. Thank you very much for being a part of this preview. We're excited about this workshop, and we're sure that this is going to help some patients. Have a great day.